basically like you saw the journey I've gone through, serving as hospital pharmacist, serving as supply chain pharmacist in the pharmaceutical industry with companies. So I work in the diagnostic, working as a researcher. I would say it was timely. It was important because to be candid enough, from school, we don't learn supply chain. I don't know. The time I went to pharmacy school, we don't study supply chain. We just normal pharmacy. But when you come out, you see yourself tangled with a lot of supply chain issues. Imagine I was a hospital pharmacist. I have to request, supplier have to call me back and forth. I have to send reports. Throughout my life as a pharmacy professional, there are a lot of supply chain issues. So when this cohort started, I become part of it. And going through the modules, I realized that indeed there was a huge gap. It has much maybe experience, but if you have the right information backed with your experience, it's better. And the cohort came in handy, and it was timely. And I would say, since the end of the cohort, I'm a different professional. I'm a different professional. Like I had the experience, but I don't have the professional knowledge. So now back the knowledge and the experience together, I think I'm a better professional. Yeah, that would say. I am ALUSINE AMBROSE MUSA. After graduating from high school, I entered the medical college, which is College of Medicine, where I studied pharmacy, and I graduated with B.Pharm honors. And again, just after the B.Pharm honors, I had my internship with the pharmacy board and community and hospital, and I sat through my professional license exams, which I successfully passed. And I gained employment with the Ministry of Health. I worked with the Ministry of Health 2012, 13, 14, and there came in the Ebola scourge. And again, I had an employment with the International Medical Corps, which is IMC. I was serving as their treatment center pharmacist. And just at the end of the Ebola in 2015, I also gained employment with MSF, where I was serving as a pharmacy manager in one of the districts hospitals in Magboka. And after MSF, I joined the Ministry of Health again. I was working with the Ministry of Health until I left for the industry. I was working with pharmaceutical companies now since 2017. I worked with Miral Healthcare, which is one of the leading pharmaceutical companies in Sierra Leone. They do wholesale importing and manufacturing. I left Miral. I worked with Miral, of course, that changed their name to Evans Baroque. And I worked with Codex Healthcare. They are doing diagnostics. So I was their business development manager, and of course training their teams and installation of their devices. And from Codex Healthcare, I left, and I went to the university again. I started working with the College of Medicine and Allied Sciences in their research department. I was a research pharmacist for the corona vaccines program in one of the districts. And at the end of the corona vaccines, I also was asked to join another project with the university, which is also under research with ICARIA, which IS Global. They are doing research on azithromycin and SP. So basically, for now, I work still working with the university as a research pharmacist. I'm a family man, and above all, I have 2 kids and a beautiful wife. Knowing who plays what role, whether it's the regional, whether it's central, they are very conflicting. And like if money comes, is it the hospital that is going to purchase? Is it the district that should buy? Is it the central that should buy? That area was not clear at that initial point because there are a lot of conflicts, there are a lot of confusion, fighting back and forth. But to be candid enough, is the area of quantification. That one it changed my whole perception. Because I was doing, even though I used the consumption data, but it was not scientific what I was doing. I was just assuming, well, they used 300. For the next 2 months, they will use this quantity. But when I started using the formula, the data that was given to us, and when I do it in real life, I realized that there was a huge difference. So the area of the quantification, even though it's not sweet, it's not anything that has to do with mathematics, It's not sweet, but just using the formulas was outstanding. And I think that was the aspect that I really appreciated. Apart from the other modules, we are very beautiful. Yeah, but that is the key for me. Yeah. Tricky, I'll say yes. But what actually gave me, like, we're all busy, blah, blah, but the video teachings were very excellent. The video teachings were very excellent. So much that I have little or not much time to go through all the notes. But the video teachings were very, very much excellent. And it's now after the whole cohort, I started going through the notes, reading line by line, trying to really, but I would say the video teachings were very helpful, were very excellent. And Sanji was a bit patient with us. We asked questions from the layman's view, from the professional view, and he was able to at least throw lights on them. The materials now, I would say it's now I'm really appreciating the materials. But before now, it was more of the video and be the test that we are going through. Yeah. Like I mentioned, before now, we are working blindly, even though we want to assume we have an experience. So for expectation, I would say yes, because the way the modules were arranged, it's as if it's a real Sierra Leone situation we are trying to solve, because everything just falls into what we need to know and what is expected of us as professionals. So I would say yes, the expectations we have met, because the modules we are well structured as to our problems we have in the supply chain and in our health system. So I would say yes, my targets were met, and I believe I'm looking forward to more opportunities to learn more, especially the way the first cohort went. Yeah, teaching method, I'll say yes, they were excellent. We are very professional, especially the side room discussions we were having. I'll come back to a general forum, we share ideas. It was not just a one-way street. The teacher made room for us to also contribute to our professional experience, which was very key. And even when one's perception thought was the best, until another professional gives an idea, so, oh, I thought this was good, but I think I'll go this way. So I think it was professionally done, it was professionally handled, and I appreciated it. Especially when we have those little groups go and discuss there. You see different perceptions, you see different views, which helps to shaping your own view as well. So I think, yeah, they were well handled. Yeah, it enlightens me. It opens my horizon to a new atmosphere. It shapes me to accept that indeed what I was doing, even though it was not wrong, but was not done the right way. But that there are better ways to do what I was doing. Like I said, so it's very helpful. It's needed by everybody. Every professional needs to get this experience we've gone through. Yeah, it's helping greatly. Basically, this like we say, supply chain issues are not just Sierra Leone issues. Supply chain is a global issue. Every aspect, every cadre, every sector in the world has a supply chain issue in one way or the other. So now I believe, as professionals, especially when it comes to the health profession, especially when it comes to the health profession, supply chain is key, because we are dealing with lives. So I believe, and I want to admonish and encourage every healthcare professional that first and foremost, the most life-threatening supply chain issue has to do with pharmaceuticals, because without a product, there are no programs, and without programs, there are no health. So I believe every one of us have gained this experience I've gotten from Be Skilled, and apply it in our daily work life. I believe we'll save the world, we'll save tons of our resources in terms of money, in terms of saving lives, and in terms of improving on our healthcare systems. And that's why I believe this experience is very much important, that we enrolled, get this knowledge of supply chain, especially the one that I gained from Be Skilled, and we've really intentionally we apply it in our daily lives, even our personal life at home. It's helping. It saves a lot. Stock management, prevention of expiration of products, vis-a-vis ensuring that the right product gets to the right people at the right time in the right quantity and the specification. So this one is very much important for all of us, not just healthcare professionals, but in whatever affairs you find yourself. This supply chain training or experience will help a lot.